But coming up,
it's one of the most misunderstood disorders, schizophrenia. A doctor explains what's real, what's not, and what's being done to help patients lead normal lives right after this break. Now, it's one of the most common psychotic disorders, and yet it remains one of the most misunderstood.
many people think schizophrenia sufferers have multiple or split personalities, but they don't. Instead, they have a split mind that cannot distinguish between what is real and what is just happening in their heads.
The illness was in the limelight in Singapore recently when a man believed to be suffering from it attacked a member of parliament by setting him on fire. So to understand what schizophrenia is really all about, psychiatrist Dr. Yong Guan joins us this morning.
Good morning, Doctor. Joining us. So why is schizophrenia commonly mistaken as a multiple personality disorder?
Well, because when a person has schizophrenia, there's a change of behavior. There's a change in personality. So friends and family members would think that, hey, he's a different person now. Used to be very jovial, friendly, and now very quiet and not sociable. So because of that, you have a different person. And they say, oh, this is a different person, a split personality. But we know schizophrenia is not split personality. Schizophrenia is split between thinking and feeling. Let me explain.
Okay.
The brain has got 3 layers. The first is the cerebral cortex for thinking. The middle is the limbic system for feeling. And then the last part is the brainstem.
Involuntary.
Sleeping,
reflexes, yeah.
eating, and breathing. And in schizophrenia, the split is between the thinking and the feeling. When the thinking and the feeling do not synchronize.
Okay.
So what exactly does that mean in practical terms?
In practical terms means whatever we hear, see, smell, taste and touch, they come to the limbic system first.
Right.
A receives all the inputs. The limbic system receives all the input. In normal people, we can swing it up to the cerebral cortex for thinking, for processing.
To make sense of what you're
To make sense of the 5 senses.
Yeah.
And when in a schizophrenic patient, this ability to swing up, to make sense of the 5 senses is absent. And when it's absent, the patient will start to have this split, so-called split in thinking and feeling. And it is this split that gives them the hallucination, the delusion, the loss of touch with reality.
As a result, sometimes the actions or the things they do are a result because they're not sure, they don't know that what they're doing is sort of out there in the real world. Yeah.
Correct.
Yeah.
Because of these, they cannot connect to the real world. Most people, when they're intact, we make sense of the 5 senses by going up to the cerebral cortex for processing. When this process is absent because of the split, then you have a lot of problems.
Well, let's talk about some examples. I mean, give us an example of a real-life situation and how a person with schizophrenia will sort of react.
Or what happens?
Okay, one good example is Professor Elyn Saks.
She wrote this
She
book.
is Professor of Law, University of Southern California.
Right.
And she developed the illness as far back as when she was 8 years old. She had phobias, she had obsessions. She complained to her family members, a man is coming into the house to kill family members. Of course, the parents say, oh, you know, you are too imaginative. When she was 15, because of the split, she started saying the houses are sending messages to me. And I can receive messages from the houses. How can house send messages?
Okay, like
so because
houses.
of the split, the misinterpretation that houses can send messages to me. And then she broke down in Oxford University when she was studying law there, and she developed schizophrenia.
But does this mean that actually the condition is not apparent all the time? If she made it all the way to Oxford, that means she was able to sort of interact normally some of the time.
Very good. Because of her sheer intellect, she's a very intelligent lady, and because of the sheer intellect, so whatever she studied, she could still remember. The intelligence was intact. Unfortunately, there's a split. She couldn't make sense of the senses. The 5 senses she was sensing. And it was only when the stress at Oxford was too much for her, she had to see a psychiatrist.
But does that mean she sort of knew that something was wrong with her? She could sense that, in a way, the things that she was thinking sometimes didn't measure up, didn't connect with what she knew from knowledge-wise.
That's right. Yeah. She knew all the time there's something not quite right with her thinking.
Okay. So does that mean that that this can be controlled? So if I'm aware I have this problem, can I control it?
Yes. medication is very important because when you take medication, the medication comes to the cerebral cortex to make sure the chemical imbalance is balanced. When the chemical imbalance is corrected, this cerebral cortex is able to link back to the limbic system.
So
then you begin to make sense of the five senses.
So it's a chemical process that causes this. I mean, are some people more susceptible to this, or is it genetic? Does it run in the family?
The genetic component is very high. If a parent has schizophrenia, the chance of the child having schizophrenia is about 12 to 15%.
Does that mean you can treat it, be preemptive instead of or sort of proactive, you know, and work before you even have it?
Yes. The genetic part is that if both parents are schizophrenic, the chances go up to 40%.
Right.
In twin study, it can be as high as 50-60%.
Yeah.
So it's quite high risk.
To answer your question, yes. If I know I have this tendency, if I have a strong family history of schizophrenia, I will take special precaution.
What are some of these precautions?
I will learn to relax. I will learn to take stress. I will learn to take care of my limbic system.
But can you train your mind to sort of think in a different way in preparation
because
for this?
we know the limbic is linked to the cerebral cortex and the five senses come to the limbic. I will take care of the five senses. I will see nice things, hear nice music, smell nice things. That's where aromatherapy comes in. Taste nice food and go for tactile experience. You know.
So stress is a trigger. And then with these new treatments like drugs and everything, can the illness be managed indefinitely? Can a person lead a normal life?
Yes. In our study, we feel that one third of the patients, especially if they come early, they can fully recover. They can fully recover. One third would have intermittent periodic symptoms like Professor Elyn Saks. Most of the time clear in thinking, but once in a while transient psychotic thoughts would come to her mind. The last one third, unfortunately, will have chronic illness and they may need long-term maintenance medication.
So you mean
like a diabetic patient, like a hypertensive patient.
But is medication the only treatment available?
No. Besides medication, counseling plays a role. In her book, Professor Elyn mentioned about her psychiatrist discussing medication with her. She was on old medicine and which gave her a lot of side effects, which she later on changed to new medication and she was much better. Besides the psychiatrist, she went for psychoanalysis.
Right. Okay.
She actually saw 4 analysts.
Yeah.
And through the analysis, she began to see all the unresolved issues in her mind, you know, and began to correct the unresolved issues.
Okay.
And one of the issues is inferiority feelings. Because of the stigma attached to mental disorders, you find that people are not willing to talk about their problem.
Yeah.
And they feel very inferior, they feel very depressed most of the time. So counseling, psychoanalysis can help to correct all these misconceptions.
It sounds a bit like mind over matter to a certain extent.
The counselling part, but the chemical imbalance must be fixed first.
Okay, so there are two parts. So you still require some medication and on top of that the counselling to help. And
lastly, rehabilitation. After the medication, after the counselling, you have to integrate the patient into society. So work placement, sheltered workshop, rehabilitation, bringing back your old skills, and trying to make you a useful person.
So that's where the community comes back.
Well, thank you for coming in. Unfortunately, we've run out of time. I'm sure there are many more areas we would like to cover. But thank you, Doctor.
Thank you very much.
Thank you, Doctor. We've been speaking with psychiatrist Dr. Guan on schizophrenia.